The Health Ministry says COVID-19 isolation beds are 85% full despite efforts to set aside more capacity. Capacity was at about 60% 3 months ago. In that time, 8 times more COVID-positive patients came to emergency departments and many were admitted as a precaution. Now, the ministry highlighted significant strain on the healthcare system and urged Singaporeans to be socially responsible by vaccinating, testing and adhering to isolation protocols when needed. Giving an update on the situation, MOH said waiting time at public hospitals for non-COVID admissions has increased by nearly 35% from July. Hospitals are deferring about 20% of non-urgent care to reduce pressure on capacity and manpower. In intensive care units, beds are disproportionately occupied by seniors who are unvaccinated or partially vaccinated against COVID-19. This segment makes up 2/3 of the patients there, despite only accounting for 1.5% of the population. ICU occupancy was at 23.5% yesterday. Overall, 20% of acute and community public hospital beds are taken up by COVID-19 patients. About 7% of all cases are admitted due to more severe symptoms or pre-existing conditions.
Meantime, private clinics are ramping up capacity to handle more patients amid the strain on hospital resources. Now, this includes hiring more doctors and nurses, as well as expanding their spaces.
As you know, we've been facing the same manpower shortage and stresses as hospitals. We have been doing our part in managing COVID-19 surges in the primary care clinic. What we have done is firstly to augment the manpower using telemedicine resources. We have also very actively started recruiting nurses, staff, clinic staff, and doctors from both traditional and non-traditional sources. But what we do notice is a surge in COVID-19 cases in our clinics. So we do see about a dozen cases per day.
Specialist Medical Centre, StarMed, has seen an increase of about 25% in patients in the past week. Now, their clinics conduct minus day surgeries that are usually done at the hospitals. While they currently have enough capacity to deal with the surge, there are plans to expand the space.
COVID has really accelerated the acceptance rate of these new models of care. So in anticipation of that, our group is actually expanding our floor space. We now occupy 8 floors. We're going to be expanding to 11 floors next year.